Meningococcal disease is a serious bacterial infection caused by Neisseria meningitidis, commonly known as meningococcus. It can lead to severe illnesses such as meningitis, which is the inflammation of the protective membranes covering the brain and spinal cord, and septicemia, which is blood poisoning. Here's a comprehensive overview of meningococcal disease. Causes and transmission. Bacterium Neisseria meningitidis is a gram-negative bacterium that can be classified into several serogroups, with A, B, C, W, and Y being the most common in causing disease. Transmission. The bacteria spread through respiratory droplets from an infected person when they cough, sneeze, or talk. Close contact, such as living in the same household, sharing drinks, or kissing, can increase the risk of transmission. Symptoms. Symptoms of meningococcal disease can develop rapidly, often within hours. They can differ depending on whether the infection is meningitis or septicemia. Meningitis, high fever, severe headache, stiff neck, nausea and vomiting, sensitivity to light, confusion or altered mental status, and a rash, which may develop in some cases. Septicemia, sudden onset of fever, chills, fatigue, cold hands and feet, rapid breathing, rapid heartbeat, and a petechial or purpuric rash, which are small red or purple spots on the skin. Diagnosis, clinical evaluation. Diagnosis is often based on clinical symptoms and physical examination. Laboratory tests, blood cultures to identify the bacteria in the bloodstream, lumbar puncture or spinal tap to analyze cerebrospinal fluid for signs of infection, particularly in meningitis cases. Treatment. Meningococcal disease is a medical emergency that requires immediate treatment. Antibiotics. Intravenous antibiotics, such as ceftriaxone or penicillin, are administered as soon as the diagnosis is suspected. Supportive care hospitalization is usually required to monitor and manage complications, including intravenous fluids and medications to stabilize blood pressure. Complications from meningococcal disease can be severe and include hearing loss, particularly following meningitis, brain damage, resulting from severe infection and inflammation. Septic shock, a life-threatening condition caused by the body's response to infection leading to organ failure. Death, the case fatality rate can be as high as 10 to 15%, even with treatment, depending on the serogroup and timely medical intervention. Prevention. Preventive measures include vaccination and public health strategies. Vaccines. There are several vaccines available that protect against different serogroups of Neisseria meningitidis. These include meningococcal conjugate vaccines, or MENA-Y, for serogroups A, C, W, and Y, and meningococcal B vaccines, or MEN-B, for serogroup B. Prophylactic antibiotics. Close contacts of a person with meningococcal disease may be given antibiotics to prevent infection. Public health campaigns. Awareness programs about symptoms, vaccination, and preventive measures are crucial in reducing incidence. Meningococcal disease occurs worldwide, with a higher prevalence in sub-Saharan Africa, particularly in the meningitis belt, which stretches from Senegal to Ethiopia. Other regions with notable incidence include parts of Europe and the Americas. Meningococcal disease is a significant public health concern due to its rapid onset and potential severity. Outbreaks can occur in crowded settings, such as schools or military barracks. Vaccination programs and surveillance are critical for controlling outbreaks. Ongoing research focuses on improving vaccines, understanding the epidemiology of meningococcal disease, and developing better diagnostic tools. Advances in vaccine technology aim to enhance protection against various serogroups. Meningococcal disease is a serious and potentially life-threatening infection that requires prompt recognition and treatment. Vaccination is the most effective preventive measure, especially for at-risk populations. Awareness of symptoms and rapid medical intervention are crucial in managing this disease. If you suspect meningococcal disease in yourself or someone else, seek medical attention immediately.